Hello, my name is Gregor Cuzak. I represent the Slovenian healthcare ecosystem called healthday.si, and it is my pleasure to be today's moderator at today's event. So the event is Slovenia EU SHAFE Interregional Policy Learning event, and today's topic is communication and information. Thank you very much to my co-organizers, Federica Porcu, and also Anita Molka, and everybody else who was involved in preparing this. So I would like to start with the first presentation. This is Mr. Franci Rokavec. He's the mayor of municipality of Litija, and we will see his video address.
AFE projekta. Najprej ne velja iskrena, če tudi virtualna dobrodošlica v srcu Slovenije, v občini Litija. Če bi se da razmere dopuščale, vas bi z veseljem s ponosom povabili na popotovanje po naših posebnostih ali v globine rudnika Sitarjevec, v katere najhitreje rastejo rastoči limonitni kapniki na svetu, ali v oglarsko deželo, kjer se postavlja kopa rekorderka, ali geometrično središče Slovenije v najvišji pustolovski park v Sloveniji. To so le nekatere litijske zanimivosti, ki jih je vredno obiskati. Zagotovo bi v občini Litija želimo ustvarjati pogoje, da bi za naše občanke in občani živeli kar najbolj kakovostno. Poseben del tega predstavljajo tudi projekti in vsebine, ki jih še posebej v zadnjem letih intenzivno izvajamo za starejše občane. V letu 2014 smo dokončali izgradnjo medgeneracijskega centra Šmelc, kjer se že 7. leto odvija dejavnost domske oskrbe 4. generacije in seveda vseh drugih sorodnih programov, oskrbovana stanovanja, varstveno-delovni center, potem predšolska vzgoja otrok, glasbena šola in vse skupaj eno, bi rekel, pester mozaik medgeneracijskega povezovanja na enem mestu. Leto 2018 smo ustanovili svet za medgeneracijsko povezovanje v občini Litija, ki sodeluje pri oblikovanju politik na področju, ki se tiče položaja starejših in medgeneracijskega povezovanja v občini Litija. 2019 smo uvedli projekt Sopotnik, ki starejšim omogoča brezplačne prevoze. Letos tem projektom dodajamo še projekt e-oskrba, Telekom Slovenije, ki subvencioniramo storitev oskrbe in celodnevne povezave preko osebnega telefonskega alarma na daljavo. Slednji dobri praksi boste danes tudi bolj podrobno spoznali. Dobre prakse zagotovo omogočajo kakovostno življenje starejših in je potrebno širiti, prilagajati stalno spremenjajočim potrebam in okoljem, predvsem pa vedno znova iskati priložnosti za aktivno vključevanje prilagajanja starejših. Veseli me, da bo projekt EU SHAFE ponudil prav to, se pravi različne prakse, ki jih imamo priložnost podrobno spoznati, pridobiti potrebne informacije in seveda smiselnosti prenosa teh v posamezno lokalno okolje. Želim vam uspešen dogodek in se seveda veselim nadaljnjega sodelovanja.
I would like to thank the mayor for his kind words. There are certain things I didn't know about Litija, although I am from Slovenia. Yes, I would like to check those stalactites, and I would like to see the charcoal hump that he mentioned. Now we will go to Mojca Štepec. She is the Managing Director of Development Center of the Heart of Slovenia. So this is a partner of the EU Šafe project. Mrs. Štepec, the word is yours.
Thank you. Dear Ministry and Municipality representatives, dear project partners, dear guests, on behalf of the Heart of Slovenia team, I wish you a warm welcome to the EU Šafe Interregional Policy Learning event. It is our pleasure to host this meeting that we will address an important domain of communication and information. Today, we will get to know several good practices which enable the elderly to be better, more efficient, simpler, and better acquainted with the things that are important to them and necessary for a quality life. In applying such good practices, one should always bear in mind the actual needs of the elderly and carefully listen to older people's voices. This should and must be at the core of each activity and each project that we are considering. Even though we are only halfway through the EU Šafe project, we are pleased that it has already made an important contribution to our policy instrument, the so-called Local Development Strategy of the Heart of Slovenia Local Action Group. Within the strategy, we are now placing greater emphasis on its goals, among which vulnerable target groups that also include, of course, the elderly, have an important place. To address this goal, a new project entitled Point for the Elderly has been prepared and already confirmed for co-financing by means of the European Agricultural Fund for Rural Development. 3 concrete points or offices for the elderly will be opened in 3 different municipalities in our area. A network of organizations and also volunteers and of course services for the elderly will be established in 3 municipalities, each according to the expressed needs of the elderly in a particular area. The employees and volunteers will attend trainings and lectures on volunteering, project management and management of these points and its services in order to be prepared as well as possible to provide the necessary and desired services for the elderly. This, I believe, is one of the steps and efforts in the Heart of Slovenia area to address all 3 emphasized shortcomings in the Green Paper on Aging that the European Commission is preparing. That is lack of access, that is especially visible in rural areas such as ours, low quality and affordability of services. Hopefully, the project will show positive results and the needs to continue its implementation. This is why I'm very happy that municipalities, who are the local decision makers, are actively involved. And hopefully, this project with its results will also be in the near future included in a booklet of best practices in another EU Šafe similar project. So at the end, please allow me to thank all of the project partners for your hard work and valuable knowledge transfer. Anita Molka, the EU Šafe project manager for the Development Center of the Heart of Slovenia, who successfully and devotedly steers this project among all the stakeholders. Of course, our municipalities who have recognized the importance of the content we are addressing with this project in their active support. And last but not least, Mr. Gregor Cuzak, who is not only the moderator of today's event, but also a great expert on the addressed topic and the person responsible that Slovenia is also a part of the EU Šafe project. Again, thank you all for your participation and important contributions, which you have already, and of course will continue to add to improve the quality of life of our valuable members of the society. Thank you very much.
Thank you very much for these nice words. Let us continue. So currently we are completely sharp on time. Although this is not the goal, it's not our goal to be sharp on time, we will try to be, okay? Anita, So you are about to present the EU-Schafe good practices in this domain. So the domain here that we're gathered today for is communication and information. And we will hear some cases from Spain and Portugal, if I'm not wrong. Please, Anita, it's your time.
Thank you. Hello to everybody. So now we will briefly present 10 good practices recognized among partner regions or countries on EU-Schafe project. And Slovenia good practice for travelers will be presented later on by the owner. So now I will present good practices from Spain and Portugal. So just that I share my screen. You all see it, right?
Yes.
Okay, so the first good practice is working group on social services for the elderly. So Task Force 3 is responsible for establishing a strategy to facilitate the empowerment of elderly to improve their social image. The challenge is to detect all those prejudices that occur in everyday media or language, and they try to correct them. So the goal is to address the problem of the negative and stereotyped image of the older people and trying to reverse or at least alleviate the ageism. 3 working groups were created, given impetus through the assignments of tasks and advice from the Provincial Council of Vizcaya. It has issued reports and organized and supported activities. It works voluntarily from a collaborative learning by doing perspective. Different people from different associations of elderly in Vizcaya were invited to set up the working group. So the next good practice is preparing your medical visit by Medical Association of Vizcaya. It's a communicative project that aims to educate for health. Target group are elderly. The goal is to optimize medical consultations, to improve communication between doctor and the patient. It helps doctors and users to better interact. It gives them the guidelines with training the patients and removes the stress and generate normality and tranquility. All the municipalities in the region have received at least 1 visit per year of the doctors, and of course supported by audiovisuals and brochures. The Medical Association contacts the intermediary agents and informs them of the planned action, and all the associations of the elderly in Vizcaya are contacted. Visits are scheduled by doctors who give a talk on how to effectively prepare a medical consultation. The next good practice is Visa di Beri. It's a communication platform that gathers opinions from professionals, volunteers, researchers about social issues such as risk of social exclusion, disability, and lack of protection. It aims to promote deep, critical, and respectful public debate on social issues, and society in general is the target audience. It's raising society's awareness of existing social problems, contributing to the adoption of social policies by public administrations, and the greater the impact of the information, the easier it is to reach a wider audience, and the awareness will be even greater. It has created also an observatory of ageism through which they are analysis the social image of the older people. So during 2018 till 2019, they held a series of workshops on the topic in different municipalities of Vizcaya, which then concluded with an international day. The next good practice is interdisciplinary research platform on aging and well-being. It gathers 30 researchers from different fields of knowledge. They're committed to United Nations Agenda for Sustainable Development, to generate innovative research results, to the benefit of healthy and active aging. So the platform is coordinated by the International Research Project Office of the University of Deusto. The participation in the platform is voluntary. They now work with 200 organizations all over the world. In order to maintain engagement, 2 plenary meetings are held yearly. It's bringing together the Deusto researchers with local, regional, and international partners and projects. They're actively involved in international networks. They also co-create in the identification of local and international social needs. The research has impact on more healthy and active aging society, the inclusion of elderly, development of new products, better healthcare management, and innovative integrated care services and policies. So the last good practice I will present is from Portugal, Rehab. It's coordinated by Caritas Coimbra. It's a multidimensional kit of innovative technologies and traditional methods that promote cognitive stimulation and functional rehabilitation through remote interaction. So the project works individually and in group settings, both in assisted living environments like daily centers and also remotely from home. The kit materials are already integrated in the weekly plan of activities of day centers and others, and the used instruments range from games for older adults to cognitive training games, which are available on a tablet through interaction with an avatar. The main service users are people over 65 in the city of Coimbra. So the goal was to increase the active participation, to help to prevent cognitive and motor decline, and to foster the older person's autonomy regardless of socioeconomic background. The project's most valuable benefits include improvement of digital literacy, increase positive outcomes in quality of life due to different trainings and exercises. So this was it from my side. Thank you. And now I will invite Tina Pregel, my colleague, to present other 5 good practices from EU Schafer project.
Fine. So Tina.
Yes, hello everyone.
It is your time now.
Just a second to share my screen.
So the cases that Tina will present come from Denmark, Germany, and Ireland.
Yes. So I will start with 3 good practices from Denmark, more precisely from the municipality of Aarhus. And the first one is called DOC. DOC is an innovative development center for assisted living technologies and digital healthcare solutions, and has a large exhibition and test space with temporary displays of the latest assistive technologies and aids. And by presenting and demonstrating a wide range of technological solutions, DOC seeks to promote curiosity and knowledge about the technologies. And by sensing, touching, and playing with the technologies, citizens of all ages will develop a better understanding of the many uses of assisted living technologies. And DOC intends to present assisted living technologies and illustrate how assistive technology is part of the everyday lives of many people of all ages. And the main results of DOC are approximately 1,200 visitors per month. Evaluation show a very high visitor satisfaction score. And the success of DOC is partly due to understanding what its audience wants, and partly due to its wide range of professionals. The employees are engineers, designers, anthropologists, occupational therapists, and psychotherapists. So the second one is Assisted Living Technology Educational Center. which provides a platform where technologies are presented to citizens and employees so that citizens can become more self-reliant and the employees' working environment is improved. And the Assisted Living Technology Educational Center has 3 objectives: to reduce the number of work injuries, to reduce the number of caregivers needed to carry out a transfer from 2 to 1, and to centralize the ergonomics lessons to one location covering all 7 districts of Aarhus in order to ensure that all caregivers are taught in a uniform and consistent manner. So the main results of Assisted Living Technologies Educational Center are the number of injuries when transferring patients has been significantly reduced. The municipality now has a centralized system for training and all care staff in transfer techniques, and teams of caregivers are much better qualified at matching citizens with relevant technologies. There has been approximately 3,000 course participants per year since the startup in January 2018. And the educational center is always fully booked and the courses get good feedbacks. The third one is the Assisted Living Technology Pioneers. Since 2018, most care homes in the municipality of Aarhus has had an assisted living technology pioneer to support the implementation of assisted living technology. And the pioneers are nurses, therapists, or health and care staff with passion and extensive knowledge of assisted living technology. And one of the many benefits of the pioneers is that they can supervise colleagues and assist their managers, and thereby contribute to a more successful implementation of new technologies. The pioneers should participate in relevant training courses and in relevant networks, and also with other pioneers in the municipality in order to disseminate and apply their knowledge in their workplace. Develop new skills and competences, and in doing so, they will be able to strengthen the implementation of technology. The main results of assisted living technology pioneers are that they are optimizing the workflow and improving the working environment. The caregivers benefit from having colleagues who can assist and teach them about the appliance of new technologies. Teams of caregivers are much better qualified at matching the citizens with relevant technologies. The stress factor felt by some employees is minimized, and citizens are becoming more self-reliant. The fourth one is Health Kiosk from Billstat and Horne districts in Hamburg. There, the problem was that the district of Billstat and Horne are among the poorest districts in Hamburg, and most medical facilities are in areas located where the social index is higher, and health in Billstat and Horne is worse in comparison with other districts. So in order to reduce social inequality and to strengthen health opportunities, to encourage stronger networking of medical and social care, and to improve care and health for people in Billstat and Horne, they set up Health Kiosk, which provides access for all people, focus on the patient, and also location is in the city center. Consultation is possible even without an agreement, and their main goal is preventive care and the reduction of the number of hospitalized. And what are the results they have achieved? Improved care for people in Billstat and Horne. The number of avoidable hospital admissions has dropped, and insured in Billstat and Horne used outpatient care almost twice as much per year compared to other. And here is the last one, Healthy Ireland Information Technology Program alone. the main aim of the program is to support older people to live independently within their homes and communities by availing a range of information technology supplied by a loan. And this program is aimed at people over 60 years of age to provide support and training with assistive technology packages like smart blood pressure monitors, smart voice controlled speakers, smart watches, sleeping patterns, emergency GPS enabled alarms, and so on. And the aim of the project is to improve physical and mental health and to improve quality of life, to increase independence and to increase overall well-being. And it is foreseen that the positive engagement of older people with wider society will combat isolation and loneliness and therefore impact their health in a positive manner. So this is all from my side, and thank you for your attention.
Tina, thank you very much. So our last speaker in this section is Felix Arietta Frutos. He's a researcher and professor at the University of Deusto. I guess this must be in Bastia.
In San Sebastian.
San Sebastian. So my first association with Bastia, besides very, very strong and innovative healthcare ecosystem, is Michelin star restaurants, which you have the highest density in the world, I guess. Is that correct?
Yeah, and in my city we have more, even more here. So in
everybody
San Sebastian
knows how to cook really well. You do as well, right?
Not really, but I try a lot. I do my best all the times, and then I try to do that. So
all right. So before starting your talk, I will invite also by saying it. Your comments or questions are appreciated in the chat function. So everybody is invited there, especially since we are running this in the webinar format. This means that attendees, it's harder for us to put you into the session directly. So perhaps we will be able to address some of the questions that you will have via chat. So Felix, please, the floor is yours.
Thank you, Gregor. Well, good morning, everyone, from here from rainy San Sebastian in the Basque Country. As Gregor said before, our team, we've done the evaluation of good practices, of all the good practices presented by all the partner countries and stakeholders. So as Anita and Tina said before, there's a lot of data about impact, about social image, about communication, new technologies, interaction, information, and all of these things that they have explained, I think, quite correctly. But we have some quantitative data about what evaluation of each project is interested to do. So that's what I'm going to comment, and of course, open to all the questions you can have. The first indicator of evaluation is how relevant are the good practice in each region. In this case, as you can see, the 50% of the evaluators consider the good practices relevant, and the 32% very relevant. So we have a slightly 82% that appreciate that all the practices evaluated are relevant or very relevant. I think this is an important data, because all the good practices that we are sharing here today and in all in other webinars we've done are in fact important policies to improve and to get a better society. So I think to think about them as an important practices and the objectives are important to the regions in the first place is quite an important thing. In the second place, not only the objectives, but the results achieved by the good practice and are also considered relevant or very relevant. As you can see, the 46% consider the results relevant and the 25% very relevant. Here, the percentage that consider the results slightly relevant is higher than before, but it's quite big, the percentage that consider them the results relevant or very relevant. So for the implementation of the public policy, then it's the important thing we are speaking about today. I think that not only the objectives of the policy, but also the results are relevant for us is a very important thing. Are these systems, this evaluation, these results applicable in other regions? I mean, not only in the regions the good practice was placed, but also in another regions, the replicability of the good practice. As you can say, the 51% say that yes, then we have quite high options of replicability, and this is what this project is about too. And even though 45% of people think that they really don't know, so we have to continue working on this area. So we have to work on how we can replicate this kind of good practices in all the regions we are working on. Of course, here is maybe you have quite a big cheese, quite a big yellow cheese, because we have a high 80% of the evaluators then agree in the stakeholders' participation in the good practices. It's adequate. So we agree that all the good practices evaluated, in all of them, the stakeholders' participation is quite adequate. I think this is a common opinion, and all, as we've seen in the good practices presented by Anita and Tina, there is not any program if the stakeholders are not involved in their implementation. So this is quite an evident data. The fifth assessment, or the fifth evaluation point is would be useful this kind of good practice in another region. It has to be with replicability, and as you say here, the 58% agrees that it could be useful in another region, even though we have here a 30% or 29% of the people that really don't know. It's another area that we have to work about. As you can see in the data, the things or the elements that have to be with replicability are those on we have to work about. And finally, the last point is about the social impact. Are the social impact of the good practice important in the region? And here, as you can see, they are important or very important for a high 73% or the people. No? So important for a 48 and very important for a 25th. So I think that the social impact, and it's one of our biggest concerns when we develop a public policy nowadays. It's quite correctly and properly evaluated here in the good practices we are evaluating. So in conclusion, here we have a high evaluation of the communication, information, good practices in all in general. There is a concern, quite a concern about the replicability of them in another region, something we have to work about. But in general, social impact and objectives and results are very quite good and properly evaluated. So thank you very much, and open to the questions you could have about them.
So I have to disappoint you a little bit because there are no questions.
Ah, okay.
But not just you. So this also goes for Anita and Tina. But I will not give you a question. I will just use one of the cues that you presented. And you said something like building of a good society, something like that. So it's not a question, but I will use it in the round table at the end, so in the panel. So my question there will for sure be, what does it mean, a good society? What is that? So yeah, you're laughing already. We will see how others will respond. Without further ado, if my colleagues agree, I would go into the next session already, in spite of the fact that we are running early, which is not typical for webinars. But I think it's in all our interest that we continue here and don't try to, sort of create something out of thin air, especially because we have a very rich discussion at the end, I guess. So there are quite some questions that are prepared there. And also, again, to all attendees, we are a very nice group at this point, 47 of all of us. And I'm also seeing a question by Grain Kumiski, if I pronounce this correctly. And the question is the following, and perhaps Felix can answer directly now before we dive into the next session. The question is, are the full evaluation results available, especially in relation to the funding and transferability of the good practices? Felix, can you answer the question?
Yeah, they are available. This is the ones I have shared with you are just the results, the graphic results. But of course, we can share the evaluation of the transferability. As I said, that's the main important aspect we have to work about. And if you share with me your email or your contact, we can share with you the evaluation aspects. And we are working on a report about them. So maybe more than just the results, maybe the report we are working on in the future will be more important, but of course we can share the results.
All right. As we said before, we will go into the next block. So those are the presentations of good practices from Slovenia. And we will focus on the communication and information tools and methods for the elderly with the aim to improve their quality of life. The first presenter for this section is Marko Zelnik. The project is called Sopotniki, which translates to co-travelers. Marko is the managing director of the Sopotniki Institute, I think also the founder, and the person with the first-hand experience. My comment will come towards the end, so I will just ask Marko to present his case. Marko, please.
Thank you. Thank you all. Thank you for this opportunity to present Sopotniki Institute. I hope that 10 minutes window is more of a guideline than an actual rule. I'll try to be swift, but I can't promise anything. So Gregor, please stop me if I'm taking too much time. So basically, like it was already said, Sopotniki Institute offers free transportation for elderly with a special focus on elderly living in remote rural areas. Perhaps the best way to illustrate what we actually do is to spend a couple of minutes to speak about how it all started. So at the moment, just to give you a perspective, our operation runs in 16 Slovenian municipalities. We run 18 dedicated vehicles to do this service. We are doing this by help of 370 volunteer drivers. And we have more than 3,200 regular users. This means elderly people who are using our service continuously, not just once. And what's really interesting is the average distance. So the distance between their home and the nearest town is more than 7 kilometers. So you can imagine that's quite a distance if you don't have your own means of transportation. And we service around 30 to 40 elderly daily. And the number is around 4,700 transportations per year. Of course, this was a bit affected by COVID situation, but nonetheless. Okay, so like I said, how it all started. Basically, after I graduated, I moved from the capital to the remote area of Brkini. So this is the southwest part of Slovenia near the coastal region, into a tiny village. And since I had the job, I still have it in the capital of Ljubljana, I daily commute to there. And very soon the neighbors and others came to me with a simple request: is it possible to drop me off in the nearest town? Or maybe could you bring me something on the way back from the store? And this was the moment when I realized how hard it actually is for elderly to live in such areas. We all know that these areas are very rarely serviced with public transportation, since the density of population is very low, and it's not cost effective to run buses there. And many elderly, maybe due to health issues, or maybe they don't have driving license, or they cannot drive anymore. So they are in very poor condition in the means of mobility. And we started to think with our friends, how can we help? And we just dived in. We invested our own money to buy first car. We printed out flyers and posters. We set up a phone number, and the very next day, the first customer called, and we offered them free transportation. So the situation I described is not specific for the area where I live. Basically, the entire Slovenia is rural area. Only Ljubljana, in the midst of EU standards, is an actual city with over 250,000 inhabitants. All the rest is basically rural areas. So how our service operates, we decided that we want to be free of charge. Like I said, we started with thinking that if there would be a business opportunity to run this service as a profitable service, then we would already see taxis driving in these areas or buses, and that's not the case. So why we focused on rural areas? Because they're the most, people living there are the most deprived of services, and the quality of life there is not the same as in cities. And why we decided that we want to run this solidarity solution, which also includes volunteers to operate. Like I said, because we wanted to run this as at the lowest possible costs, and that we can offer this free of charge for elderly. What we've realized in these 7 years that we operate this service is that we started to use the phrase that elderly are becoming the prisoners of their own homes. They are dependent on their children or grandchildren to take them to the nearest shop or to bring them something, and they are even if they are offered an opportunity to leave the house, they're very rarely decided to do, because they're used to the way they're living. And now when there's this service is available, and that our volunteer is very nice to them, and he speaks to them, and they establish this like an space of, I don't know, some safe space within the car where the elderly feels accepted. this encourages them to do something new or to try something new. Usually the first time they ring us is because it's something very necessary. They need to visit the doctor. But once they have this experience and everything went really well and they felt respected and so on, they start thinking, oh, maybe I could visit now my friend I haven't seen for so many years. And that's usually the second time they ring us up. And we're really, really happy about this development, because we see this service more of like a social service than an actual infrastructural mobility service. So we are always saying that volunteers are the heart of our solution. We do everything in our everything possible that we make them this experience as pleasurable as possible, because we try to, I mean, we cover all the costs. We take really good care of them in the means of insurance, and we are offering all the trainings and workshops and mentorships. Basically, we're doing all in our power to establish this space that they can chat and help elderly, because that's the reason why they joined us in the first place. Of course, we also work with local shops and local restaurants and negotiate free lunches as a donations to our volunteers. So that when they are driving, they also can use free lunch and so on. So the main groups of volunteers are job seekers, newly retired. This is the largest group. So people who stopped actively working but are still very keen to help others. And the third group are students, maybe some self-employed people. There's also corporate volunteering and stuff like that. So these are our volunteers. Like I said, the solution enables elderly to live longer outside the professional institutions. It enables them an access to all the services they need. And like I said before, it enables them social interaction and feeling of acceptance. And this has really positive effects on their health. And of course, this is something that I want to speak about also. We don't just answer to the needs of elderly. We also call them and engage them to invite them to attend, I don't know, some cultural events and so on. So we know we have this database of users, and we see an event coming up, we ring them up and we say, did you know that next Thursday is this event? We can take you there. And by inviting them, they're very likely to respond. And then they're really happy that they did go there. So in order to run this solution, behind everything is a really complex IT infrastructure that we developed ourselves. I'm from IT world, actually. So we've developed all the system we need to handle reservations, fleet management, and so on. We've developed a volunteer app that volunteers use while they're doing their work, so they can simply call the local coordinator or customer or start navigation. We've even developed a pilot based on blockchain technology, which aimed to provide a transparent data how we use donations, because we strongly also rely on funds from donations as well. Like I said, all this infrastructure was developed by us, and it's customized to our needs. We also do these special projects that are like an extension of main service. One of those is On the Road to 1,000 Wishes. Because we mainly do like these basic needs transportations to the doctors, to the shops, to the bank offices, and so on. But in partnership with Toyota here, we were given an additional vehicle that with which we can do these special kind of trips, and we take elderly across the country and to visit, I don't know, their grandkids or something like that. So we call this like granting wishes for elderly. And here are also Olympic Committee people joining as volunteers, and this is something that really brings a lot of happiness to elderly. We started negotiating discounts for our users. So we did, from our system, we can print out these coupons for elderly and help them, because a lot of them are facing also financial struggles, and this really helps them. We are now developing an intermodality module, which combines our service with public transportation services as well. So meaning that we do this transportation from elderly's home to the nearest train station, and then the elderly goes by public transportation. We print them out this travel itinerary where they have all the data, which train they should take, when it's arriving, how many stops are in between, and so on. And also, this is a brand new project. We are, like I said, we have established this partnership with Toyota, and they saw how strong our IT infrastructure is. So they said that they want to support our mission by developing a new mobility solution, not just for elderly, but all people living in rural areas. This is not free of charge of solution, but together we believe that we will create a new way for providing on-demand transportation to rural areas. The pilot is starting in this September in Kočevje municipality in Slovenia. So our vision is, since we saw that the situation is very relatable in all rural areas across Europe, we want to extend our service even outside the borders. I think we have the knowledge, we have the system, and can be of great support to everyone who wants to set up this solution as well. So I would just like to show you a couple of photos from the field. We were very affected by Corona crisis. So you can see that all the vehicles have this plexiglass installed between first and the second row. We've set up additional vehicles to deliver medicines, drugs to elderly, and also meals. And we were driving tests to laboratories and stuff like that. Right now, one of the main purpose of transportations are taking elderly to get vaccines. This is we do our solution in cooperation with municipalities and other bodies. Also, here is the Red Cross. This is from municipality of Zagorje. This is from Litija, where we do this within Europe Mobility Week. The mayor of Litija was a volunteer driver for that day, and this really means a lot to these elderly people. Usually we need to take them to hairdressers one day before that they are ready to meet the mayor. And elderly always are telling us, our volunteers, the stories of, I don't know, from their youth, or usually when we take them, sometimes they want to go from the elderly home to visit their actual home and stuff like that, and they're telling us these stories. Since we operate in rural areas, always also quite hilly, we need to have vehicles big enough and strong enough to handle such conditions also. We're trying to bridge the gap between generations, so we present our stories to also to kids, and this was one project where the kids designed these shopping bags for elderly, and we then distribute them to them. This was because we couldn't do an actual event due to Corona. Okay, I hope I was quick enough. So we always say, if we in local area, if we all the different stakeholders such as municipalities, local businesses, and volunteers, if we work together, we can realize our motto, which is that we are all on the same journey. Thank you very much.
Marco, thank you very much. We will answer questions after this block. So I will now invite Črt Kanoni from Zveza društva upokojencev Slovenija. I don't dare to pronounce this in English. I hope you will explain in English. Basically, you are the biggest network of organizations dealing with the pensions people, so basically the elderly. I invite you to start your presentation, and we will take the questions and answers at the end of all those four participants. Thank you very much.
Thank you, Gregor. Hello to everyone. Well, the translation is Slovenian Federation of Pensionists Organization, something like that. Well, in the last year and a half, our life have changed dramatically, correct? I hope so. During the COVID pandemic, we mainly missed the company of family members with whom we are not in the same household. We missed the company of friends and, of course, freedom of movement. The slogan, "Stay at home," started to appear in all social networks because we wanted to warn ourselves over and over again that something invisible is life-threatening us. Suddenly, we had a lot of time for everything else, but not for regular activities. Of course, I'm not talking about senior citizens who are no longer tied on labor market to work obligations. So what to do? How to get wrapped up? How to spend our time from morning till evening? Suddenly, our freedom of movement has been taken away. I know a lot of pensioners who know how to use mobile phones, read and send short messages, but a significant percentage of everyone does not know and does not even bother to answer it because it takes time. Maybe the letters on the screens are too small, so we prefer to call. Many of us have entered a period dedicated to our own education to eliminate those shortcuts that seem unnecessary to us in normal life, and we solve them in a different way. Many bought or borrow laptops or tablets, while others provide smartphones, and intergenerational learning in many families runs smoothly. Older people diligently learned the basic of using the browser on the phone, and their grandchildren were amused that once they found themselves in the role of teachers. Today, after a year and a half, we find the use of Zoom app as completely normal. More or less all the meetings, alignments took place and are still taking place by Zoom. Many went a step further and got to know Skype, WhatsApp, Viber, Facebook, Twitter, or Instagram. For majority of seniors in urban communities, we can say that we have witnessed an internet revolution. Namely, suddenly we started to access services that connect people, programs, application, devices, online services just for us, for our own education and enrichment of knowledge. For step forward, hand by hand, with much younger generation that grow up with contemporary IT. In the past decade, the Union of Pensioners Association of Slovenia has paid a lot of attention to education, publicity, and informatics. Of course, we organize these trainings both in the national level, Ljubljana and Izola, and at the local level. Many of other lecturers worked in the regions and local societies in which we are members. Of course, we must ask ourselves if we had the interest to be informed, if we want to accept new knowledge brought to us by modern technology. Let's go now to statistics that will put some beliefs on the real ground. According to Statistical Office of the Republic of Slovenia, the share of people with digital skills is growing, but last year, as many as 28% of people aged between 16 and 74 had a lack of digital skills and 17% none. Both groups represent 45% of active population, which does not have the appropriate skills or conditions for qualified life in today's digital society. Slovenia is below the EU average in the e-skills segments. As a matter of fact, this is ensured by some more or less binding international documents how to raise this percentage. Digitalization is not only a matter of companies, but for society as a whole, as it contributes to the wider socio-economic development. New services and solutions in all areas allow us to use new ways of business, communication, education, entertainment, etc. The UN Universal Declaration states that no one is allowed to be subjected as degrading treatment, Article number 5. And if the state does not intervene to protect the most vulnerable people, this constitutes a violation of declaration. And now some optimistic facts. The Federation of Slovenian Pensioners runs an extraordinary program named Seniors for Seniors, which started in 2003. Slovenia has slowly recognized this program, which was in 2017 awarded by European Commission as Citizen of Europe. In the period of prohibition of physical visits, our volunteers has made more than 60,000 phone calls or sent text messages, produced 35,000 masks, organized several online workshops of exercise to maintain health and better well-being. In the first quarter of this year, volunteers performed more than 25,000 visits to mostly 20,000 persons, performed more than 70,000 various aids, made 20,000 telephone conversations, organized more than 5,000 gatherings, escorts, walks, readings, and board games, performed more than 2,000 shipments, made more than 1,000 deliveries of goods and food from stores, delivered more than 1,000 humanitarian package and food, performed almost 1,000 assistance in housework, enforcement rights, and municipality patronage services, home care, institutions, and many, many other. More than 3,500 volunteers of this program have proven that we care about fellow seniors. The Union of Pensioners Association of Slovenia accept with bitterness rumors that our volunteers are invisible. They are certainly not visible for the 20,000 needy elderly people that we visited and those we offered and organized help to. Thank you very much.
Mr. Kanuni, I also thank you from my side. I will now invite Brigitta Dane from Symbiosa to tell us about your project, or two projects actually.
Okay, just a second. Okay. Okay, why it's not working? Okay, we're working now. Okay, First of all, I would like to make a brief introduction of who we are and what we do. So Symbioza Genesis Social Enterprise is an NGO with status of social enterprise. We were founded in year 2014. Our mission is to promote intergenerational cooperation, transfer of digital knowledge through the concept of lifelong learning and volunteering. Our main objective is to empower all the generations with the digital knowledge, but we are especially focusing on raising the digital skills and providing the access to ICT tools and services to the elderly population. So how do we do it? Through our many sustainable projects, but at this point, I will just emphasize two of them. This is Symbioza Bătăță City Lab Innovative Center, which is located in Ljubljana. And here on a daily basis throughout the whole year, from Monday till Friday, the different ICT workshops for elderly are executed by Symbioza volunteers. And I would at this point like to announce that we are very proud since during the Corona crisis, we have managed to put all our activities, also for seniors, online, and we were very surprised with the result and the participation, and that's why, as I said, we are very proud of that. The second project of ours is Symbioza School, which started in 2014. It is actually a network of 23% of all the primary and secondary school in Slovenia. So, what is the project all about? The pupils in the local communities are executing digital workshops according to our curriculum in the local communities. They have a mentorship of the local coordinator, which is normally a teacher, and of course the mentorship from the Symbioza team as well. Also in 2020, we have upgraded the Symbioza School project in so-called Symbioza Community Project. When we opened the door to join into this network, also the to other organizations like libraries, community centers, and so on. And I'm also proud to announce that in 2020, 146 organization has joined in to execute whether the digital workshops for elderly in their community or executing other intergenerational activities. During the 2020, we were very busy, and we also have launched two digital and social solutions, Čveki Phone, free of charge phone line for elderly, and Magda, mobile app for elderly. Both digital and social solutions were unique in Slovenia and one of its kind. So let me see, okay, let me first present Čveki Phone. Čveki Phone is a joint project which we implemented together with another NGO, Slovenian NGO called Humanitarce, and with a cooperation with all the telecommunication operators in Slovenia. So as I said, it is a free of charge phone line for elderly. It is very, and it's very easy to use. First of all, the user must, of course, make a registration by calling the Čveki Phone number. The registration is very simple and it's also very safe. Also there are available also pre-recorded voice instructions, so it's really easy to do the registration. After the user made the registration, he is then directly connected to the randomly selected user of already registered user of Trackifone network. What is important is that neither the caller or the receiver, when the call is made, do not see their personal numbers. Of course, they can exchange it later on if they want to, but that is the main thing, so that it's totally anonymous. Trackifone operates daily from 8 a.m. until 8 p.m. And since its launch in the first lockdown in April, Trackifone has chatted over 4,600 hours. Over 135,000 calls were made in Trackifone, and it's connected 1,600 elderly people from all the Slovenia. I would also like to emphasize that the Trackifone project is recognized by Slovenian government as a project of national importance. Also, during the COVID crisis in 2020, we have, during the second lockdown in November, launched a mobile app for elderly called Magda. This was the joint project of Symbioza and our strategic partner, BTC City. What was the aim of Magda is that we wanted to provide the application which will have all the relevant information for elderly at one place, at one app. But I must say that although it seems that Magda might be another response of Symbioza on the COVID crisis, I would like to say that this idea of a mobile app is old as our story. So we will, but of course, COVID crisis was the trigger which kind of speed up all the process. So when you download Magda from App Store or Google Play, you see this lovely lady here, and you can recognize this is Magda, and here is some tricky things. Here is also one elderly man. For him, we still don't know his name and the role in the app, so we think, but we are pretty sure that he will have the huge importance in upgradation of Magda. But let us see what we have in the app at the moment. So what I'm displaying to you is the main menu of the application. Firstly, you can see it's a section called Magda's News or News. Here on a daily basis, Symbioza team uploads different news from different contents which are provided by our partners. In the info točka, we have info point. We have carefully selected and put in the app the providers of products and services for the elderly. Among them, also Sopotnik is included in the app. So what offers this section also is that via the app, the user can call, write an email, or search the web of the provider who is included in the app. Then we have so-called Magda's classroom, where the different video tutorials on the topic of ICT, how to use computers, how to use internet, how to use smartphones are uploaded. So yeah, and also the Magda's gym. Here are videos of how to do different exercises, how to move, how to do different exercises, and which are adapted for elderly. The app also provides the very simple registration to our users to our Symbioza events. Of course, there are also incorporated some SOS numbers, which can be also directly dialed via Magda app. We also added the possibility to listen to radio among the programs of the national radio. Also, some regional radio station can be listened to our application. Of course, we have then the section about the application, frequently asked questions, and the settings of the app. And of course, there is also the possibility to call directly call Symbioza if they need any assistance regarding everything, mostly. So we have a lot of phone calls, you can imagine. So now let me take you just to have a brief glimpse of how it looks like when you tap on a different category. For instance, now I'm showing the category of the news. If you see, it's really easy to manage and navigate through the application. Here we have like the icon which directs you to the main menu, the icon for one step back, and in below menu you can see 4 major categories: news, info point, classroom, and gym. So because we are now in the section of news, you see the icon is colored in orange. These are our Symbioza colors. And so if I would like to make see what's going on in the info point, I will just tap on this, and I will be immediately transferred to this category. And here, if you can see, by tapping on the icons in this category, you can start the call, email, or search the web, as I was.
Brigitte, I would kindly ask you to go towards the end of the presentation.
Yes, I had just finished it.
Thank you.
Okay, sorry. So yeah, this is it. Since the app was launched, we have recorded over 1,500 downloads. Thank you, and I'm so sorry if I was a little bit long.
No, it was fine.
Okay,
I would like to keep some time for the discussion at the end.
Okay.
So now Elena Nikolaučić from Telekom Slovenia, the national telecommunications operator. From basically phone lines to care for the elderly. We will ask questions later, so I will have a few questions for Elena, which we also discussed prior to this. But Elena, now please, the floor is yours.
Thank you, Gregor. Thank you also from my side and share with you our experience in connected services of long-term care.
Elena,
Yes.
I would like you to go closer to the microphone. I guess it's on the laptop because I don't see a headset. So if you go closer, we will hear you better because we are losing sound a little bit. Thank you.
Okay. Is it better now?
It is better now.
Okay, thank you. So just let me share my presentation. Okay. I hope that you see it.
Yes, we see it.
Okay. So maybe for starting, just a short, just a brief background for the beginning. So as Grega said, already mentioned, Telecom is a national telecommunication operator in Slovenia, but in last years also provider of comprehensive ICT services with focus on development and introduction of new technologies like IoT, 5G, and so on. And in this field, one of the focuses in this field are also services of integrated health and care enabled by innovative ICT solutions. In this field, our aim is to cover the needs of our users from long-term medical conditions to temporary situations like long-term care solutions at home. We also aim to increase efficiency and to improve healthcare and long-term services in Slovenia through user-centered and personalized care in all environments, in hospitals, at home, elderly homes, and so on. Of course, with enabling proactive and preventive care to formal and informal carers. Our solutions have covered different modules from monitoring and assistance to condition management, self-care and well-being, and activities of daily living. On these premises, on the goals that we wanted to achieve, we developed the concept of a smart system of integrated health and home care. This system connects the user at home to the telemedicine center or assistance center, to the doctor or medical professionalists or care providers 24/7. This is the basic concept that that offers the infrastructure, and therefore the services are quickly and easily developed and also applied in the practice with new users, professional and end users. In these last years, we developed, since now we managed to develop 2 lines of services, e-care and e-health, and I will shortly introduce them, just a quick glance of these services in next minutes. But if you are interested, you can also check the video presentations on YouTube on our services. For starting, e-care services. So e-care was mentioned already a few times today, is intended to assure to the user safe and connected living at home. It's a modular solution which very easily adapts to the user's needs. Equipment, it's a classical telecare service. So the equipment is installed at the user's home, which enables triggering the SOS call when needed. But we also offer the newer, the second generation solutions where sensors are installed in the at home, at user's home, and alert caregivers and assistance center without the triggering of the call. The assistance center is, of course, of very big importance. It's available 24/7 and is directly connected with the user. In the assistance center are trained assistants, mostly, most of them are healthcare workers that are trained and have a lot of experience with giving help to elderly and to patients in even most complicated situations. Maybe just for a better insight, we talked with Gregor that maybe some user experiences will be helpful. It came to my mind that the case of one of our users, it's Miss Elisabetta. She lives at her apartment in Ljubljana, and she had quite some experience in last year with e-care. First incident that she had was that she fell and she had hip fracture. And with the use of eCare, she triggered the call, and with the use of eCare, she was in 20 minutes at the emergency room in the clinical center of Ljubljana. Then she returned home, and after 3 weeks, it's a very short time, in just 3 weeks, she had another incident. She felt really badly, and she also, again, she triggered the call. They took her to the hospital, and she had a minor stroke. So she is very keen on sharing her experience, because she believes that her experience would help also other elderly persons that maybe are not so prepared to start using services like eCare. We have plenty of stories. We could go on and on, but since we don't have time, because users are very really like to share their experience with us, the bad ones and the good ones, of course. And since now, maybe just for information, since now we had about a little bit more than 1,000 users in last years. For our users, it's very important that eCare is a social service, is classified as social service, because this gives to the users an additional value, assurance that the service is properly working and giving them the real added value. As the mayor of Litija at the beginning mentioned, some municipalities, for now are more than 30 municipalities, are subsidizing eCare to their citizens, because we know that most or many of the persons, dependent persons that would use services like eCare have a very low social status, and that's why they can't afford to buy the service. And here in this point, municipalities offer their help and subsidize the service. eCare was also used in the national pilots of testing, where they were testing solutions for the introduction of long-term care legislation in practice. eCare is very important for elderly and dependent persons, also for patients, disabled persons, because it enables them to be active, independent, and to live safe and longer at their home. But it's also important for their caregivers, because it's simplifying their day-to-day tasks and eliminating their worry around the issues like health and safety when they can't be near their relatives. It's very important that the services are very easy to use, and they for the end user are very easy to use and from a proven concept. As I said, we have two lines of services. One is eCare, the other one is eHealth. eHealth is focusing on giving healthcare to the user, healthcare at home, and with remote patient management of chronic disease and other healthcare situations like COVID, pregnancy, diabetes, deterioration of conditions, and so on.
Alina, I will also ask you to.
I'm coming again. Telehealth is, so our eHealth services are not just monitoring, but it's important. It's a little bit different from some other practices in other countries, because it's also enabling the remote treatment to the doctor from their ambulatory to the patient, who is at home. Maybe just for finishing, because I'm running out of time. During the pandemic, Slovenia struggled with shortage of medical staff and medical beds for COVID patients. And in just 2 weeks, we managed to establish the COVID telemedicine center in University Clinical Center in Ljubljana. This telemedicine center treated over 1,000 patients with COVID, with significant lower costs and with much bigger user satisfaction. So maybe just for ending, I would like to share to outstand a few topics, maybe just the standards. The standards for providing ICT services in health and long-term care are of extreme importance for providing stable and quality services and also safe services for the users. With the users, I mean professional users and end users. And I'm quite sure that the standardization of ICT requirements will help to empower the users and to quickly spread the use of e-health and e-care services. Just the general idea of what are the main effects of e-care and e-health services, so the users can stay longer at home, less hospital patients, and with higher quality and satisfaction.
Elena, this was really nice, also in terms of now closing the presentation. I will thank everybody who put the questions in the Q&A, and also our speakers who already started answering most of those. I'm not saying all of those are answered. I also invite my co-panelists now to turn their cameras on. So Marco, Brigitta, Chert, and Elena, you're invited to come on. I will give some comments. If somebody would like to ask, use chat now at this second, because the Q&A has, everybody else can also answer there. We will make sure that we record all the questions. So if somebody would like to have some presentations, etc., I think it's a part of the project that things are shared, but we will make sure that everything is answered after this session. Now questions, my questions. I will use the privilege that I have here. Marco, my question to you is your service. I think it's a wonderful case of organic growth, and it grew mostly from mouth-to-mouth communication. Can this be accelerated in any way, or do you want to accelerate it in any way, or how would you want to do that?
Yeah, of course it can be accelerated, but we were, I would say, quite cautious about how quickly we expanded the service, because we wanted that, I mean, we still do, we want that our solution means the same, it operates in the same way, whether it's on one part of the country or on the other. Because we want to achieve this standard of service that people can then identify whether it's in their town or the town next to them and so on.
I would like to inform, if I may, I would like to be more concrete in this case. I apologize for jumping in, but still, there are 16 municipalities in which Sopotnik is present at this point. Slovenia has 212 municipalities. So even just expanding to Slovenia will still take some time. And that is what I'm referring to. So what is the right speed in your opinion? So when will you cover the whole of Slovenia, or will you cover the whole of Slovenia at all?
I mean, we don't have an objective to conquer Slovenia, because we also expand our service not just in the means of area, but also, I would say, vertically. We apply different solutions to we see our service as like a platform that we can apply new solutions to that. So we are, like I said, I presented a few other things that we are doing also, and this is like another way how to we expand our work. But we didn't do like a promotions. We are just answering the municipalities who are coming to us at the moment. But of course, we are applying for EU funds, and we are trying to also start some projects across the border. I mean, we are very open to that, and we really look forward to. I think now we are 7 years in this ecosystem, and so we know how things run here, and we are quite confident that we are ready to expand when the opportunity comes.
Thank you very much. I would like to ask Federica or Heather to enable chat. Somebody just informed me that chat is not working. Thank you very much. Marco, I will ask Mr. Canoni about the 45% of the elderly who have, let's say, a deficiency in terms of using the digital tools. In the questions that we got from the attendees, somebody said, did we measure, did this improve now after the pandemic, or hopefully, now in this time that we will end the pandemic in the near future? We don't know exactly. Are you seeing the situation improving or not?
Well, it's hard to say if something is changing on or is...
But 45% is a large number. That is what I'm referring to. That's why I'm pointing it out.
Those group represents 45% of active population.
Yes.
Well, but if you see now, let's say, urban society in majority city in Slovenia, let's say over 100,000 population. I mean, those digital skills among Slovenian seniors are much better than in the country side of Slovenia. Well, there is hardly you find a signal for mobile phone. It's hard to. It's very difficult to visit a doctor or a service in municipality by phone. I mean, by phone, not by IT. So we are in Slovenia is very disintegrated in those circumstances. If you see from this point of view, I mean, in one side of Slovenia, we have tremendously developed skills. In the other side, we have a Stonehenge.
Okay.
It's very hard to operate in Slovenia and speaking which part of Slovenia is IT developed or which one is not. But generally, we can say that there where the government is closing post offices, where the government is closing bank offices, this is not good way of developing such skills, which leads to IT literacy.
Thank you, Mr. Canoni. This was a clear answer. Brigitta, I think you didn't point out something very interesting in the back. I hope I can. And this is the grant you got from Google. How did that come about? Why is Google interested in supporting Magda, Chekaphone, and Symbioza?
Well, I think the answer is clear. They have spotted that we are really tremendously working towards our mission. And yes, we were really surprised, not surprised, we were honored to get that funding from Google Org. Yes, and well, it was not just that they supported our previous project, as I mentioned. We have developed, and what we are going to do in July and further on is we establish a mobile vehicle classroom in order, what was Chert saying, to reach out to these rural areas in Slovenia and use and provide our services practically in every village in Slovenia. For the next 2 years, we have we set up over 240 visits to those remote areas, and I think that this will also, and it's not only that we will, that Symbioza team and the volunteers will execute these different ICT activities and workshops, but it's also that it's what is important, that we will actually come to the community and to speak up to the local community authorities to kind of do something about on the long term in this problem. Okay.
Okay, Brigitta, thank you very much. Elena,
Yeah.
Question to you. So obviously, you know, the type of service that you are providing can be very, very beneficial to many elderly. However, the figures currently are still, I would say, low. That I also think that you consider them to be low. What do you think is necessary to broaden this acceptance in the market? We see these services across Western Europe primarily are reaching higher numbers, higher penetrations. So is it just the maturity of the market? Is it the availability of, I don't know, money to do that by households? What is your view?
Yes, you're right. Yes, a little bit of all these reasons that you just mentioned. But I think that the financial situation can be solved. It can be solved with the new legislation that is also including services like e-care, and it can be solved with the help of municipalities, because quite some municipalities offer to the citizens the e-care services completely free. You know, they cover the whole monthly cost of the service. But most, for me, or from our experience, the most important or most useful, let's say, what could we do to spread on the use of these services that can benefit all of us, like society, is to promote the use of on the national level the use of these services, to promote services like for every elderly person should get and should use as a prevention, not when they need it. They like, you know, like the seatbelt in the car, that should be promoted on the national level. And I think that campaign from the national, let's say from ministries and other maybe institutions on the national level would be more useful than from different providers of service.
Excellent. Thank you very much. If there is a pressing question at this point, we managed to open the chat now. It was not open before, but now it is, according to the information I have. If not, if a question doesn't appear now, I will thank my presenters in this section, and we will continue to the panel that we have. So I would just say thank you very much at this point, and let's continue. We are now entering this last part of today's event. The panel discussion is importance of communication for and about the elderly. So for and about the elderly, what does it mean? So if I go first to Mr. Aleš Kinda, from the Ministry of Work, Social Matters, I will need your help here in terms of how this is properly explained in English, like with Chert Kanoni before. So Chert is also joining us in this panel, and Lea Lebar from the Faculty of Social Sciences. I think I got this one correctly. My view to start this panel is the following. 5 years ago, I would say that we had some project services that were not as mature as we see them now. So if we just look at the situation at this very moment, somebody might say, okay, fine, perhaps we are lacking the projects that are covering the whole nation, with the exemption of ZDUS, so the Federation of Pensioners. But still, you know, we have to be somehow aware of how we bring good practices from 15 or 16 municipalities like Sopotniki to a wider scale, which is typically, it is quite a challenge, and it requires financing, regulatory framework, and other things. But still, my main point here is that in Slovenia, we are in a much better situation in regards to maturity of some of the projects than we had 5 years ago. And I've been even participating with Symbioza, for example. I was involved there personally, and I see the progress. So the progress, even, you know, how you survive certain periods in which you have to learn how to cope with the money, with how to run the projects, how you report, etc. So I think we are in a much better position today, in spite of the fact that we are not seeing this from the public. So if we go from the public side, somebody might say nothing changed. My point is things have changed in the last 5 years. And also to crown this off, the law on the long-term care was accepted by the Slovenian government just last week. And this is a special moment, I would say, since it's been 20 years in the making. So, Aleš, can you make a brief comment to what I just said?
Gregor, thank you for the floor. Well, I can say that in last years, many things has been changed in positive way, but I think that much more things is still open, much more things still have to be changed. What was the reason that we see also the positive and the negative effects of in these last years? 5 years ago, we adopted an active aging strategy. It's a modern strategy. It helps us a lot, but I think that not all levels have adopted to this strategy, have used the positive effects of this strategy. So I'm just observing this situation from the point that we still have a lot to do.
Okay. Mr. Kanoni, your career in Slovenia made you a public person somehow. So everybody who is on the call here in Slovenia knows that Mr. Kanoni was a journalist at the national television, if I'm not wrong. Please correct me if I said something wrong. However, I do see a challenge on how, from your perspective, you reach the public, so the general public, in terms of the importance of what you're doing at this point. So how is this achieved, or where do you see a lack, or where do you see opportunity? You have to unmute yourself, Mr. Kanoni. Unmute. Yes.
Thank you, Gregor. First of all, can I ask you, did you read Cervantes' Don Quixote?
No, I admit I know the point, but I do admit I have not read the novel.
Well, when I joined the Slovene Federation of Pensioners, I must say that it was quite a thrill for me. Later on, I saw that all the pensioners in Slovenia are in a way a second-class citizens.
Okay.
Nevertheless, look, all the money that comes to budget of our federation each year was in last year and in this year. I think I'm not wrong if I say that we got from the government less than 50% of our budget from 2019. It's quite impossible to develop all the programs which we have. Well, some of those programs are financed from the government, but the other are not. And we must find our money to develop our programs in the market. We must found the program of our partners, which are, must say, some insurance companies, some banks, and telecom, of course. But that's not enough. I mean, if government means sincerely that they are taking care for Slovene pensioners, the system of financing our association must be completed in a budget, of government. We need for developing our programs about 1 million euros per year. But this 1 million we must take very, very, very carefully with this money, because look, it's more than 500 association of pensioners in Slovenia. We are a federation, we are a headquarter. And all those more than 250,000 pensioners, which are our members, they are they need their money for spreading their programs in sport, entertainment, for recreation, for dramatic acts, for folklore dancing, for choir singers, and so on and so on and so on. It's enormous number of those programs which are in those associations, and those associations suspect of our federation that will finance them. If we don't get the money, how can we tell them we don't have money? So you have to cut your programs. No, that must be a field of spread conversation with the people which have scissors and a fabric in their hands, and we must sit down and talk about what shall we do. Shall we be just pensioners, or shall we be well, the second-class citizens?
This is a very strong thought. I think it got quite deep in my brain, at least. So this definitely is a pressing issue. Second-class citizenship in any regard. So be it ageism that we heard about today, or racism, nationalism, or any type of ism that we are seeing. It's also often that people feel that they are second-class citizens in whatever position they are. Anyhow, it is important. So, Mrs. Lea Leber from the Center for Social Informatics at the Faculty of Social Sciences, what is your not just comment to this, but what do you think? What are the things that need to be done, and not looking just at the perspective of whether there is money, because sometimes a vision needs to be created. So, what, in your opinion, is a vision And then later on, with the vision being strong enough, the money is pulled into creating the vision. So what is the vision in your view? Unmute yourself, please.
Sorry, yeah, hi everyone, also from my side, and thank you for the invite to this very interesting event. Regarding the vision, I think today we have heard a lot of very good practices, very good ideas, very good things that have developed bottom up, and despite your optimism, you know, it's good to be optimistic, but it's still, we can see there's 212 municipalities in Slovenia, and 16 municipalities are currently supporting Sopotniki, and 30 are co-financing e-care. The general vision is to be able to support the older adults on an equal level in all around Slovenia. And this is currently something that is not really happening because as we know, the care or the taking care of elderly is organized more or less on the municipal level. So in relates to the communication, I think the municipalities should be our first starting point, where we go into discussions, where we try to inform them about the possibilities that are available. And it's unfortunately currently things are quite different among them. E-care is one example. Home help, for example, is another. It's not related completely to this topic, but it can be free in some municipalities, and it can be up to 8 or 9 euros in others per hour, which is of course not acceptable for people. So in general, my vision is that we should have equal distribution of services, and let's hope that this law that was now adopted, that the government will achieve just that, and that also some of the services are going to be available or in co-financed also on the national level, not just on the municipal level.
Okay. There is please, Alesh, I see you raising your hand.
Thank you. Well, money is important, but money is not everything. I see also in different areas, not only in Slovenia, also important steps forward. For example, we all know that older persons are very diverse. They are very heterogeneous population. Each of us imagine different older people. Someone imagine someone who is in nursing home. Another one imagine someone with dementia. Another one imagine someone who is jumping with a parachute, and so on and so on. They are all older people, but they are very different. And in addressing older population, we need to be very careful not to fall into stereotypes about older person. This line to ageism is very, very tiny. And let me say some remarks about the title of a panel, which is now open, regarding the diversity of older population. The title of this panel is The Importance of Communication for and about the Elderly. Well, for me, it would be much more accessible the importance of communication with older persons, because this would show the respect and the equality to older persons. And something perhaps more important, today I heard the word elderly, I think 50 times. But I don't know if you know this, that the word elderly is not more desirable in European Commission institutions and in the UN institutions, and also in many countries, and Slovenia is also joining to these countries. Why is elderly not acceptable anymore? Elderly is a form of ageism that contains stereotypes and prejudices towards older persons. And it connects age with frailty, with dementia, with the need for care. However, older persons or older people underlines the aspect of personality and recognizes the complexity and heterogeneity of this population group. And we don't need the money for changing the mind, and this change is happening around us. And I also see some good examples from Slovenia. So I suggest to all of us to avoid the word elderly and to use the word older persons and older people.
I'm sorry, can I maybe just add a sentence, because
Please
because just to add something regarding the vision, because I really regret not mentioning it before, because also the vision is to spend your old age at home in the community. This is something that I have to stress a lot, and because it's not because in Slovenia, we somehow have this background of institutional care, of the ideas of the institution, and it's not very typical in the European setting, this part. And because we have this tradition, and when we think about where are we going to spend our old age, we think about a home for elderly, but it's not true. And all the good practices presented today are related to the community care, more or less. And this is the part that in my vision needs to be strengthened and supported. And I really hope that the future goes in this direction.
Okay, thank you very much. I wanted to add on to what Aleš said previously, and I do agree with the point of course, what should I say, with the elderly. Now, the point that perhaps I should make at the end of today's roundtable, but I will make it now, and also just to inform everybody, it was planned that we finish about now. So we will extend. I discussed earlier with Anita. I hope Federica and my colleagues agree that we will extend it for 10 minutes. So we will stop in basically a little bit less than 10 minutes time. My final point here that I would like to make, and perhaps we have a discussion around this, is what is the value of, but not economic value. I don't want to discuss economic value here. And I want to illustrate my point if possible. So if it's possible to share my screen, which currently I can't do, I will show you, now I can. So sharing of the screen, I will show you something. Yes, I will show you this. I don't know if, is the screen visible? I mean, I know that the next slide is also visible. I don't care, that's not the point. So it's basically a Slovenian illustrated fairy tale. And I already used it at a presentation about silver economy in Galicia about 2 years ago. And the whole story is what is the value of the elderly people. And I would like to posit basically the idea that the elderly person has a tremendous value, and I even wrote in my preparation that anybody, any person, of course, but in specific the elderly person is like a treasure, and it is on us, the society, to basically unlock the treasure, and we see this treasure when we speak to our own relatives. So I will show you the story briefly. So the point is here. It says that the wheat is the most beautiful flower. The story goes like this. So there is a kingdom in which the king has all the elderly removed. Let me not say what the king does with the elderly, but he has them removed. So there is a guy here who decides to hide his dad, his father, who is elderly. And then what happens in the kingdom is that the king's daughter, princess, wants to marry the wisest of the suitors, and he gives the suitors a challenge. Not just one, 3 challenges. I will stop after the first one, and I will tell the rest of the fairy tale to anybody who's interested afterwards. So the first challenge is, show me the sun in the morning, the first ray of sun that appears. And of course, the kid consults his father, and the father says, don't look at the east, look at the west and look at the peaks of the mountains, because there you will find the first ray. And the story continues. After 3 challenges, all the challenges are won by the son, but because of the wisdom of his father. And that is my point. I would like to make sure that if family relations, I will stop sharing now. Thank you very much. So if the relations within a family, which is our basic cell of the society, are proper, and in most of ours are, I would assume they are, then we need to build a society with this knowledge in our minds. So if my grandmother falls and breaks a hip, I will be completely interested in the replacement of the hip, whatever the age. Okay, and I will not look at the cost of the replacement of that hip, whatever happens. So in a way, the relationship we find within the families, we need to find within our society. So any comments, my dear colleagues? I took a little bit longer. Alex.
I will be very short. I will just set a question and then I will answer to it.
Okay.
To whom do we have to thank for the development of our civilization we are experiencing today? The response is to today's older generation and to previous generations. So I have no doubt about my attitude to older generation. Thank you.
Mr. Cannoni?
Well, must admit that maybe I am the last from my generation who grew up with his grandpa and with grandma. Most things which I learned in my childhood, I learned from my grandpa. Grandpa was a treasure of for any question that I have for him, he found it in his chest of knowledge that he has. I mean, older person are a treasure of knowledge, but nobody wants to listen them. Do you know, it was a very popular group in Slovenia in the 60s, Belevrane. Belevrane, they have a very nice ballad. It was named the City of Young People. And one of the lyrics said, "We will not allow anyone to enter our city, which is old. We shall surround ourselves with a wall, and this will be our city." Well, maybe it's very egoistic to look from this point of view, but I mean, when I was a kid, my grandpa lived with my parents. All my brothers and all my sister, we lived together. And we learn from each other. I mean, me as a younger child, I learned much from my older brother. My older brother learned very much from my father. And my father still, he was a grown-up person. I remember that he was listening his father. I mean, the word of my grandpa was a law in our family. It was unwritten law, but it was something that everybody's word in our family has its place. So we must go to the roots now, and we must find what do we really want to be a homogeneous nation, I mean a unique nation, or shall we separate ourselves? This line is for people under 20 years of age. This line is for people under 30 years of age, and a background where are no seats. This is for older persons.
Okay, now we will give the privilege of putting the dot to the I to Lea Leber. So your remark is the final remark of today.
Thank you. I feel like Mr. Canoni's remark should be the final remark of today because of the, you know, your words and what you have said, and all of your comments and all of your experiences that you shared today. What I want to say is that I, of course, agree with both of you, and that I hope that my generation also manages to follow your examples, to do the to provide the respect that is needed, and yeah, well, basically that's what I wanted to share. So it's really hard to follow this deep.
It was a nice dot, so you put it on the right spot. Thank you, Mr. Canoni, thank you, Mr. Kenda, and thank you, Mrs. Leber. If there is something else from my organizing colleagues, please step up and tell it. Otherwise, I'm closing this session. Thank you very much.
Thank you.
Thank you.